Everybody, so welcome to this live on how to overcome IBS using the gut transformation program. So this is a fantastic program. It's one that I have used myself and I use it all the time with my clients and just get incredible results. Like it's a 6-week program, but even after a couple of weeks when we have a review call, I'm just so overjoyed and happy for my clients that they're just seeing such positive effects on the symptoms that they're experiencing. So yeah, it's really good to have that feedback. And one of the real reasons why I do use this program so much with my clients in my clinic and outside of the clinic now as well. So with the beauty of virtual technology, we can actually do this and still support people with IBS, which is one of my key passions. So before we get into everything, and thank you so much for anyone who jumps in and joins here today, and also for anybody else who jumps in after, anyone who wants to share, so that we can kind of like let people know that there are alternatives when you're not getting anywhere with the doctors or the hospitals like I wasn't. So yeah, before we start, for those of you who don't know me, my name is Ruth Tansey. I'm a bank registered nutritional therapist, a colonic hydrotherapist, wellbeing coach, and also a yoga therapist. I am 45 years old, single as of last June. I have one cat, no children. And I'm really, really passionate about health, wellness, nutrition, just living that clean, healthy lifestyle. I literally do live and breathe it, but it wasn't always like that. Be completely honest with you. I had a long history of poor health, mainly IBS. IBS symptoms plagued me for such a long time, probably from earliest recollection around the age of 15. I was probably talking like 20 years, and in my early 20s, very, very bad, in and out of hospital, cameras everywhere, loads of tests done, and everything was just normal. Put me on IBS medication, of which none of it worked. So I ended up doing a lot of research myself, seeing lots of different practitioners, seeing nutritional therapists, and that led me later on in life to become a nutritional therapist. And I love the work that I do. I love supporting my clients. I love understanding about the science behind food and using food as medicine. And at the moment I'm working on my functional medicine university degree, so that's all come together nicely. So yeah, I think that's probably enough about me for those of you who don't already know me. So let's get into a little bit of the detail. So to kick off, we're going to be looking at 4 key areas. So what IBS is, but more importantly, what causes IBS? Because I know I was forever seeking that. What is causing all these symptoms for me? So we're going to look at that. And then we're going to look at the gut transformation program itself, so what it is, how it works, and what's included. And then I'll give you an overview of how I work in clinic with my clients to tailor this program to their specific needs, because that's really important as well. And then finally, we'll have a look at what you can do right now to really help and support your own IBS symptoms. So for me, all the disciplines and all the training and everything that I have done, I really feel that it's given me a really good grounding and a real deep understanding of not just the physical, but the emotional aspects that really do play such a key role in IBS. And for me especially, when I was poorly, it took a lot of, kind of soul searching. So finding the root cause for me through diagnostic testing was key, but then I also had to look at, and you may need to do the same, look at other areas of my life. So my lifestyle, my diet, which wasn't so great back then, my lifestyle and pace, relationship issues. There are so many things that can be affecting the gut. So really important to really do some digging. This is what I do with my clients as well, ask thought-provoking questions and really get to the nitty-gritty of what's going on. So let's kick off with what IBS is then, for anybody who doesn't know, just to be sure. It's not a disease, you can't pass it on, it's not contagious. It's a syndrome. It's a collection of symptoms, so irritable bowel syndrome. We tend to find most clients, patients will present with either constipation or diarrhea, but for some people they have intermittent diarrhea, and it's so important to find out what is at the root of that, because there are many different reasons why someone will have constipation with diarrhea. So when we work with clients, again, we're really looking at the detail, the case history, and asking lots of questions to find out what is actually going on. So as well as that, you've got your abdominal pain, cramping for a lot of people. It might just be like really, really awful discomfort. I know mine was. I just had awful discomfort, constantly bloated, so bloating, another symptom. And then the pain side of things, very much on the left-hand side a lot of the time, you'll find underneath the rib cage. And then we have those unpleasant symptoms such as the flatulence, the wind, the burping, all those lovely things that nobody really wants to experience. So we want to be getting rid of them. We don't want to be, having to put up with that. So yeah, those are a lot of the symptoms, but we also see a lot of, and I had these as well, a lot of other symptoms do come up when you've got IBS. So not always just related to the gut. You've got to think about mood swings, depression, anxiety, and that a lot of the time is to do with the serotonin. So we house so much serotonin in our gut. So when the gut's out of balance, the serotonin's out of balance. Serotonin being a happy hormone, so you can understand how it can affect the gut, affect the mood, and give us, things like irritability. I was always irritable. Mood swings and just not feeling great. And the headaches because of the toxicity, especially if somebody's suffering with constipation, which I did. So headaches were quite a key player in my symptoms with the irregularity of my bowel. So you may be experiencing the same. Other symptoms might be expressed through the skin. So things like psoriasis, acne, eczema. All these things can be a direct result of things not going too well in the gut, and why it's so important that we look after our gut, and the gut being, the place where all disease starts. Big believer of that. We really do need to understand that. It's so important. So if we look then onward, we will come to what causes it, because that was what I was always looking for, what is causing it, and there are so many things that can cause IBS. So again, it's that kind of soul searching and finding out more, or working really closely with someone who can help you. So we have things like food sensitivities. So you will find a lot of people will display lots of issues with sensitivities. It might be wider than just food. It could even be to medication and supplements and things like that. There's also underlying bacterial infections a lot of the time, yeast infections, dysbiosis, which is an imbalance between the gut bacteria. And then we have SIBO, so small intestinal bacterial overgrowth. And this is, kind of like from research, what they believe represents about 70% of IBS cases. So a good one to check, and I do the breath tests with my clients quite regularly to find out whether they have high methane or high hydrogen gas that's driving their IBS symptoms. So it's an easy test to do. It does take quite a bit of preparation, but it is fairly easy to do, and not too expensive either. And because it's so prevalent with IBS, it is a good one to test for. So parasites as well, they can be an issue, and I do see them come up quite a lot when we do diagnostic testing. So that can be a cause of IBS. And lifestyle, you've really got to look at lifestyle and diet. Is your diet causing you the issues? Too many stimulants, too much alcohol, too much sugar, all these things as well. So things to think about. And then, through testing and through obviously the gut transformation program, it's been devised really to help alleviate so many different problems. So if we look at the actual program itself and how it works and what it is, so it's, like I've said, phenomenal. Just such a great program that I've used myself, like I said, and I use with such great success. And it follows the principles of using food as medicine and also using nutraceuticals. So nutraceuticals being natural medicine, so rather than pharmaceuticals being synthetic. So they do work with the body, keeping everything in harmony, balancing everything out, and not doing any harm. So that's all good. So it is 6 weeks to healing the gut. It's been devised by nutritional therapists, and it works on a really well documented 5R protocol. And anyone who's not familiar with a 5R protocol, who's not in my world, so remove, replace, re-inoculate, repair and rebalance. So it goes through these stages. So when we're talking about remove, so when you first start the program, we are encouraging you to remove any bad foods from your diet. So what are bad foods? So junk food, obviously, processed foods, but also white carbohydrates, not just white bread. We're looking at white pasta, white rice, anything basically white. You really want to be removing it from your diet. We are also going to be removing stimulants. So a lot of people are drinking way too much coffee. So caffeine is out, alcohol, dairy as well. Dairy can be such a huge player in driving IBS symptoms. And if all this is sounding like, oh my God, I just can't do this, and probably if I look back to maybe my history, my journey, there would have been a time when I'd just been like, I can't do all that. So what we tend to encourage for clients where there is that real block, that real resistance against just removing certain things from their diet, is we encourage you just to reduce as much as you can for the best results really from the program. So yes, hopefully that all makes sense. As well, in the program with the reduce, you get the supplement. You get a supplement called Candida SIBO, and that really helps to kick out the bad bacteria. And by its title, Candida SIBO, it's getting rid of the SIBO as well. So that's a really great antifungal, antimicrobial, antibacterial that is in the remove stage of the program. So that's remove and then replace. So what we want to do is we want to replace anything that's missing. So we can do this through a couple of ways. So we would initially look at your 7-day food diary, and we would recommend anything that was missing that we would add into that. So we would make those recommendations. But then we also want to make sure that you can actually not just digest your food, but assimilate it. So by assimilation, we mean we can actually use the nutrition from the food to actually heal the gut. So that's what we want to do. We really do want to focus on healing, and digestive enzymes are just going to help give that support so that you can break down the food into your gut, and you can utilize that to enable your body to heal. So that's what we use, and they're very gentle, very effective, plant-based digestive enzymes, and we just take literally one before each meal, and then also looking at foods that could be missing. And then we come to re-inoculate. So that part of the program is to do with re-inoculating the healthy bacteria. So we're going to be using some really well-researched strains of probiotics. So they're not all the same. The ones in the program, I've got a lot of research on them, all the different strains in there, well documented for helping to heal the gut and really great for IBS symptoms. So, everything that we said was symptom-wise for IBS are really good at helping to support that. So just, I just spent so much money on really inferior products when I was, going through a lot of symptoms, just kind of grasping at anything to try and help myself. And then later on, kind of learning and researching and, doing courses on probiotics and learning all about the difference between them makes me really passionate about sharing this information with people. like it's worthwhile investing in good quality supplements and understanding that they have to have a genus, a species and a strain. And the strain is where all the research is done. So you can pop it into Google Scholar and you can see, has there been research done on that particular strain? And I'm just going to have a sip of water because I had a dry throat. So, as well as the probiotics that are actually in the program, you also have fermented foods. So we have recipes for fermented foods. So sauerkraut, kefir, kombucha is also in there, and I have these regularly still in my diet. I absolutely love supporting my gut. It's about, you know, supporting the whole body when we do that. So you get those lovely recipes, and they're dead easy to make as well. Everything in the program is dead easy. You know, the recipes are really super simple. So that is a re-inoculate. And then when we come on to repair and rebalance, so we're looking at specific powders here because we really want to get the nutrition in. We can't get enough nutrition in when we use tablets or capsules. So we're using these powders that work synergistically together to help repair and also rebalance the gut. So they are really effective. And then also what you will be encouraged to do is to be following the program, to be mindful of the foods that you're eating, obviously getting rid of the processed foods, because the key thing here is, you know, if we're going to pollute the body, if we're going to put in all this crap into our system, how the hell can we expect it to heal? You know, we really can't. You know, it just destroys our bodies, and we really need to understand that it's not food. So yeah, that would be, if you're following the program properly, then you will hopefully kind of like fly through it. And in 6 weeks be, well, even 2 weeks for a lot of my clients, just be seeing such incredible results. So, do I need to tell you anything else in that respect? I don't think so. So in terms of then how I work with my clients in clinic, very much working one-to-one with my clients. So you would be filling out a health questionnaire and a 7-day food diary. We would then book you in for your consultation, where we would take a detailed case history, review your food diary, and then we would score a MIME up, so a measure yourself medical outcome profile, where we're going to score your 2 most debilitating symptoms. So important to do this because this gives us this baseline reading. And then we come back to that at the end of the program and we rescore it, and we see those well, hopefully, generally, I see them come either completely down or like gone altogether. So, and that's just so rewarding to know that people, you know, have had such great results with the program in such little time. So when I'm working with my clients, then I want to make sure that they are progressing through the program effectively. So we have review calls every 2 weeks. So the way the program works is it's kind of split into 3. So you would follow the remove part for 2 weeks, the re-inoculate, and then the repair, rebalance, etc. So what I want to make sure is after the 2 weeks of, say, remove, are you now ready to go on to repair, or do we actually need to keep you on remove for longer? Example, for me, I had God knows how many years of a yeast infection. Say I had 20 years of a yeast infection. Is that really going to get rid of in 2 weeks? No. Also, I was super sensitive. So maybe the levels that are in this program, if you're also super sensitive, are going to be too high. So we have to titrate. We have to start low for a lot of our clients and then work up to what we know is a therapeutic dose that's really going to get to the resolve that the client needs. So I like to work with my clients specifically just to manage them through the program and make sure they're getting the best results. So we have these calls every 2 weeks just to make sure, and they're free, make sure that you're on track. I ask you to give me some feedback, and then we decide whether we keep you at that stage or we move you on. And then at the end of the program, we have a full half-hour face-to-face or virtual face-to-face now review. So I'm taking down asking some key questions, taking down the detail, and then we rescore the MIME up. So that is how I work with my clients, just to make sure that everyone is getting that resolve that they need. And I also want to make sure at the end that there is that continuity, that we are making sure that everyone feels supported, so that the IBS symptoms are just kicked into remission. So there you have it. That's how I work with my clients. And then the last stage that we said we would talk about is what you can do right now to help alleviate some of your symptoms. There are so many things that we can do. So first off, look at your diet. Look at what you're putting in your mouth. You know, and look at your drinks as well. You know, is there a lot of alcohol? Is there a lot of caffeine? You know, the gut doesn't like all this. It's a stressor. Stress is such a huge issue. And generally speaking, the driver, or the trigger, should I say, for all diseases and all syndromes, including IBS. It really, really is. So we need to be aware of, you know, people think about stress, they just think of emotional stress, but stress comes from pain in the body, from an illness, you know, any structural irregularities, even things like lack of self-worth or purposefulness even, lack of life purpose can be a big one, a big stressor. And then we've also got obviously all the electro smog from our phones and computers, TVs, microwaves. So yeah, stress comes from everywhere. We're kind of literally bombarded with it. And stress also if there is an underlying yeast infection. So yes, we want to be aware of all these things. So the things you can do then. So diet, look at your diet. Look at getting rid of the processed rubbish. Look at either removing or at least reducing the wheat and dairy. Even if you've done a test and it's come back that you're not sensitive or intolerant to either of the two, they are so difficult to digest that I do remove them with my clients. If not straight away, then we progressively work towards reducing and removing. And sometimes it's just you just need a little bit more support to do that, and I did, to be fair. So diet is a key one that you can look at. And sugar, yeah. Think about sugar. Think about how much sugar is going into your body, because I know a lot was going into mine, and it's so damaging and it's so aging as well. So yeah, be thinking about sugar, reducing stress, obviously, because stress is a key one. Other things that you can do. So in removing stress or managing stress better, things like mindfulness practices, yoga, obviously, meditation, like daily meditation. Just 5 minutes of meditation has been shown to really, really, really improve IBS symptoms, or just generally improve how we're feeling, reduce our stress, and in reducing our stress we will affect our IBS symptoms as well. Food wise and how we eat is a big one. So chewing your food thoroughly, like really sit down and take your time when you're eating. Super important to do that. Count the amount of times you chew your food. You want to be chewing your food at least 20 times, you know, possibly more. So yeah, think about chewing more. Sit, relax when you're eating as well. Ideally at a table. I know a lot of people do have their dinner in front of the TV. Not a good idea, because you kind of switched into your sympathetic mode, which is fight and flight, and we want to be in parasympathetic, which is rest and digest. So as much as we can do to get ourselves into our rest and digest will help with our IBS. And if you know you're a sensitive person as well, then this is going to be so important for you. If we think about how the body works, the brain is born, or the gut and the brain share the same chemicals, born out of the same part of the embryo. So if you're a sensitive person, whatever goes on up here is going to affect your gut. So we do tend to find that people who have IBS tend to be more on the sensitive side of things than people who are not. Is there anything else? So, I know what I was going to say. If you're constipated, if constipation is one of your key things, then try giving your abdomen a massage in the morning. Really helpful. So clockwise direction. You want to do this for ideally maybe a minute, but you know, whatever you can do is going to help. And then actually sit on the toilet. So simple as it might sound, a lot of people don't sit on the toilet every day, and we actually need to get the brain and gut to connect again. So a lot of the time that connection gets missed. So by regularly sitting on the toilet, and I would recommend getting the feet up, so get yourself a squatty potty or something you can get your feet up on. Get the hips up, will really be helpful. And then add some healing foods in, like you can do this right now, things like an organic aloe vera juice. I use pucca. Pucca's really great. There's other ones, just as long as it's organic and in a leaf fillet, it should be a really good quality one. And then obviously like the fermented foods as well, so think about your sauerkrauts, your kefirs and kombuchas that you can get now in the shops if you're not in a position to make your own right yet. And I think that's it. Oh, sleep. Yeah, so just making sure you get a good quality. So we're talking 7.5 to 8 hours sleep every night. So you might be like me, who suffered with insomnia in the past and need a little bit of support there. CBD oil, the calm one that we do, is so effective for that. Just a couple of drops under the tongue at night. Great for IBS if stress is one of your triggers as well. You know, I can find that we can get such a great resolve just using CBD oil with people who stress is their main trigger for all their symptoms. So what I would say then, if this is all sounding like something that you want to do, if you have been experiencing a lot of IBS problems, symptoms, I would just say do it. You know, don't procrastinate. It's a phenomenal program. It's just delivers such great results time and time again. Like literally, if IBS is plaguing your life, then you have got nothing to lose by doing this program. It is so effective. So I really would encourage you to get involved and you know, sign up. And if you sign up today as well, you do get a bonus. So I'm actually offering the half-hour consultation, the review consultation, for free, but anyone who signs up today. So that's 2 free review calls and then a full half-hour review session at the end. So you're saving roughly, what is it? You'll be saving like £115. So your total investment, if you do come on board, or should I say when you do come on board and do this program, is £247.99, and that includes all your supplements for the full 6 weeks. That includes your initial consultation with me, which is an hour and a half. That includes your bi-weekly review calls, and then also now your review session at the end. And then within the gut transformation program, you get all the recipes, so you get to keep them. You get a shopping list, which is great, so you know exactly what you can and can't eat. And there's so much goodness in it, so much good food, and it's nice. Just get into like healthy eating and, you know, interested in supporting your gut and your gut health. So yes, I think if you are thinking about it, don't think about it too much, just get in touch, sign up, and yeah, let's just kind of get your IBS symptoms into remission. It's also a great one if for anyone who's got irritable bowel disease as well. Great for healing in that respect. So just great all rounder for the gut, and also supporting the immune system, since that is where we house our immune system, in our gut, our bowel bacteria. So I hope this has been helpful, and if anybody wants to email me, then please do go ahead. Also, if anybody wants any gut healing recipes, I'm starting to put some together. I'm actually writing a book at the moment, and some of the recipes that I've got already will be going in that book, and that's going to be more obviously in depth in terms of a gut transformation program. So thank you to all of you who are with me. So I can see Caroline, you're in here, and oh, you're saying so that made a real difference to your gut health. Yeah, That's great. So you have got good bacteria working in your gut regularly. Yeah, perfect. So you're barely having your colitis flare-ups now. That's amazing. And then yeah, I know when we did the retreats last year at Healthy Home, and we did a workshop on making kombucha and kefir, and Caroline's taken that up, and she's been doing it ever since, and I love it and have it every single day. Regularly make the batches, and just great to support your liver, great to support your gut health as well. So